A patient with advanced COPD expresses frustration about being unable to breathe comfortably despite maximal therapy. The most appropriate nursing action is to A. Increase oxygen flow rate above prescribed limits. B. Discuss the patient's goals and explore palliative options. C. Focus only on medication adjustments. D. Encourage the patient to avoid talking about distress. Answer: B. Exploring goals of care allows for personalized interventions that align with comfort and dignity in advanced illness. A family insists on continuing aggressive treatment for a dying patient who is suffering. The nurse's best initial response is to A. Request a family meeting to discuss goals of care. B. Inform them that aggressive treatment is unethical. C. Call the hospital attorney. D. Proceed with all requested treatments. Answer: A. A family meeting allows open communication, shared decision-making, and alignment of treatment with patient values. When providing palliative sedation, the primary ethical justification is A. To alleviate intractable suffering. B. To hasten death. C. To decrease family anxiety. D. To test medication tolerance. Answer: A. Palliative sedation is ethically justified to relieve unbearable suffering when all other interventions fail. Which symptom is most distressing and commonly reported by palliative patients near end of life? A. Diarrhea. B. Dyspnea. C. Hiccups. D. Itching. Answer: B. Shortness of breath is among the most common and distressing symptoms requiring careful assessment and management. When a patient with terminal cancer experiences increased agitation and confusion, the nurse should first A. Restrain the patient for safety. B. Notify the chaplain. C. Increase sedation immediately. D. Assess for reversible causes such as pain or hypoxia. Answer: D. Delirium may be reversible. Identifying and treating underlying causes is a priority before sedation. A dying patient requests to stop tube feedings. The nurse should A. Explain that feeding is necessary to sustain life. B. Respect the patient's decision and discuss comfort measures. C. Continue feedings per prior order. D. Notify dietary services only. Answer: B. Respecting autonomy is central in palliative care. The nurse supports informed decisions about life-sustaining interventions. The most accurate tool for assessing pain in a nonverbal patient is A. Wong-Baker Faces Scale. B. Verbal Descriptor Scale. C. Numeric Rating Scale. D. Flack Scale. Answer: D. The Flack scale assesses behavioral indicators of pain in nonverbal or cognitively impaired patients. A nurse notices a patient's family avoiding the topic of death despite prognosis. The best nursing intervention is to A. Ignore the family's denial. B. Encourage the family to leave discussions to the physician. C. Emphasize medical facts only. D. Provide gentle opportunities for discussion about the dying process. Answer: D. Sensitive, open communication supports family coping and readiness for end-of-life transitions. In hospice care, the main focus of treatment is A. Curative therapy. B. Comfort and quality of life. C. Rehabilitation. D. Clinical trial enrollment. Answer: B. Hospice prioritizes symptom relief and emotional support rather than disease cure. For a patient with refractory pain unrelieved by opioids, an appropriate next step may be A. Corticosteroid therapy. B. Antipsychotic use. C. NSAID discontinuation. D. High-dose benzodiazepine. Answer: A. Corticosteroids can reduce tumor-related inflammation and enhance analgesic effects in refractory pain. A patient states, "I feel like a burden to my family. The most therapeutic response is A. Your family doesn't feel that way. B. Tell me more about what makes you feel that way. C. Focus on positive thoughts instead. D. That's not true. Answer, B. Encouraging expression of emotions validates feelings and supports emotional exploration. During morphine titration, the nurse observes myoclonus and confusion. This likely indicates A. Allergic reaction. B. Disease progression. C. Dehydration only. D. Opioid neurotoxicity. Answer, D. Myoclonus and confusion suggest opioid toxicity. Opioid rotation or dose adjustment may be needed. Which intervention best supports a patient with terminal restlessness? A. Bright lighting. B. Frequent repositioning and reassurance. C. Continuous activity stimulation. D. Withholding medications. Answer, B. Gentle care, reassurance, and comfort measures reduce agitation during terminal restlessness. A nurse suspects a patient's family is experiencing anticipatory grief. A key sign is A. Anger toward staff. B. Relief after death. C. Emotional withdrawal before death occurs. D. Denial of illness. Answer, C. Anticipatory grief often manifests as emotional distancing before the actual death. In palliative care, the total pain concept includes A. Physical, emotional, social, and spiritual suffering. B. Only physical discomfort. C. Pain that is unmeasurable. D. Pain due to medication side effects. Answer, A. Total pain recognizes multidimensional suffering requiring holistic assessment. A patient's advance directive requests no CPR. If cardiac arrest occurs, the nurse should A. Initiate chest compressions immediately. B. Follow the patient's directive and withhold resuscitation. C. Call security to confirm orders. D. Delay care until family arrives. Answer, B. Honoring advance directives ensures respect for patient autonomy and legal compliance. The most appropriate non-pharmacologic strategy for managing breathlessness is A. Using a fan directed at the face. B. Restricting air movement. C. Reducing oral fluids. D. Increasing physical exertion. Answer, A. Cool airflow from a fan stimulates facial receptors and reduces the perception of dyspnea. What is a priority nursing goal when caring for a child in palliative care? A. Focus on disease cure. B. Support developmental play and family presence. C. Avoid discussing prognosis. D. Restrict visitors. Answer, B. Maintaining comfort and allowing normal family interaction preserves quality of life in pediatric palliative care. In palliative communication, hope is best reframed as A. Expectation of cure. B. Possibility of comfort and peace. C. Avoidance of suffering. D. Wishful thinking. Answer, B. Reframing hope toward achievable goals, like comfort, helps maintain emotional resilience. Which is a key ethical principle guiding palliative nursing practice? A. Beneficence. B. Competition. C. Authority. D. Litigation. Answer, A. Beneficence ensures actions promote the patient's well-being and minimize harm. The most accurate indicator of imminent death is A. Increased appetite. B. Decreased urine output. C. Elevated heart rate. D. Hyperactivity. Answer, B. Decline in kidney perfusion causes reduced urine output, a key physiological sign of approaching death. A nurse observes a patient's spouse refusing respite care. The best nursing intervention is to A. Respect the decision but offer support resources. B. Demand the spouse accept respite. C. Call social services immediately. D. Ignore the situation. Answer: A. Respecting caregiver autonomy while offering support maintains trust and promotes self-care. For a patient with refractory terminal pain, which method offers last resort relief? A. Palliative sedation. B. Ice massage. C. Yoga therapy. D. Cognitive therapy. Answer: A. Palliative sedation may be ethically used when all other treatments fail to relieve intolerable suffering. A nurse teaching a new hospice volunteer emphasizes that the main goal of hospice is to A. Extend life regardless of quality. B. Control symptoms and support dignity. C. Reduce hospital profits. D. Promote experimental treatments. Answer: B. Hospice care focuses on dignity, comfort, and patient-centered quality of life. When supporting a grieving family after death, the most therapeutic action is to A. Remove the body immediately. B. Allow time for goodbyes and provide privacy. C. Discuss paperwork first. D. Leave the room quietly without interaction. Answer: B. Providing time and space for farewell rituals helps facilitate healthy grieving and closure.